Does PZP interrupt estrus cycle? No. PZP, there are many published literature on PZP, on the use of PZP in mares, primarily written by two individuals, Dr. J. Kirkpatrick from Montana and Dr. John Turner from the University, from the Medical College of Ohio in Toledo. When you inject or vaccinate a mare with PZP, it does not interrupt estrus cycle. All it does, well, I have to back that up a little bit. Initially, for the first few years, if you give PZP, depending on the formulation, that's why I'm hesitating here. One formulation will have an effect on estrus cycle, and the other formulation will not, at least unless you give it 4 or 5 injections over the next, over 4 or 5 year period of time. Depending on the formulation, if you use Zonistat as an example, sometimes it's referred to as liquid PZP. If you use a 2-dose regimen of PZP, it will not have any effect on the estrus cycle unless you inject the mares yearly for the next 4 or 5 years. If you do that on a yearly basis, then it will have an eventual effect on the estrus cycle. However, the first year or 2 or 3 years, the mares will continue the cycle and on a regular basis, and it will not even interrupt the interval of the estrus cycle. So the answer is yes, the answer is no. That depends on what formulation you are using. The other formulation does interrupt the estrus cycle. As an example, the use of Spayvac have shown, or will be shown very shortly, that when you use Spayvac, another formulation of PZP, that will shut the mares down within 14 weeks. Now, shutting the mare down is obviously suppression of follicular development because that interrupts the estrus cycle. That may not be such a bad thing. Most people view that as being a sterilant. No one knows at this point in time whether shutting the cycle down is a permanent thing or is it only a temporary thing. Although you will hear more frequently in the next few months, if not years, that some of the PZP formulations are shutting down the mares permanently. And this actually is not true because it has not been shown that this is a permanent situation, that this is not a permanent situation, and it could be one that will last for only 2, 3, or maybe even 1 year. We will know that probably, my guess is within the next 2 or 3 years, we will have the answer for that, because there are several ongoing investigations regarding the use of all 3 contraceptive agents. But these experiments take a long time because it's a 3 or 4 year situation.